Namaskar. I am Dr. Biswaranjan Nayak, Consultant Brain and Spine Surgeon, AMRI Hospitals Bhubaneswar. 8th June is observed as World Brain Tumor Day. It means that everybody in this world should be aware of brain tumor. If you know about a disease, you can win over the disease. So, this day I will inform you about brain tumor so that you can win over the disease. There are more than 140 types of brain tumor. So, how can we recognize them? We can recognize them through the symptoms of the brain tumor. The symptoms are mainly headache. The headache is mostly in the early part of the morning. It is associated with nausea and vomiting. After vomiting, usually the headache subsides. There is decreased vision. There may be fits or epilepsy, weakness of hand or a part of the leg or one portion of the body may be there. There are involvement of the various nerves like nerves of the eyes, nerves of the nose, like the smelling may be affected, taste may be affected if the taste nerve is involved, hearing nerve is involved, then hearing may be affected. So, depending upon the position of the tumor, the symptoms are presenting differently. So, if you have any of these symptoms, you have to go to any perfect neurosurgeon who can handle these types of tumor in a better way. So, after going to a neurosurgeon, they mostly advise CT scan of the brain or MRI scan of the brain. CT scan is the basic investigation and MRI is the advanced investigation. By doing the MRI, we can localize the tumor, where is the tumor and how it is graded and what is the proper way of treatment. It depends upon the MRI finding. Nowadays, so many advanced methods are there. Suppose there is tumor in the pituitary region, we can approach through the nose. Pituitary tumor arises from the pituitary gland, which is called the master gland of the body, and it is present inside the brain. So through the nose we can approach to that tumor and you can remove whole of the tumor instantly. And after that, patient lives throughout his life perfectly. So no scar surgery. Some other types of tumor which arise in the ventricle inside the brain, we can approach to them through endoscopic approach, through a small borehole or mini craniotomy. Small craniotomy we do, small incision craniotomy, and you remove the tumor almost totally you remove the tumor. Another types of resection is awake craniotomy. In awake craniotomy, as you know, you have gone through the various media papers. Awake craniotomy is so much hyped today. By awake craniotomy, the patient is awake and we remove the tumor in total. After that, the patient directly go to his room and he is able to walk, stand, eat. He do everything perfectly after that surgery. So there is nothing to worry about the brain tumor if it is diagnosed early and treated in a proper hand. So please know about the brain tumor and treat them accordingly.